Does obesity cause type 2 diabetes? You'll find doctors who will say that. And I think doctors are kind of fixated on obesity or overweight, as and they'll use anything to get somebody to lose weight. Every time when I was overweight, literally every time I went to the doctor, he would say something to me like whatever I complained about. If I had any complaints whatsoever, he would say, well, it would help if you lose weight. When I complained about pain in my knee, he didn't ask if I injured it. He didn't ask if if I tripped, if I could associate it with it. Nothing. All he said was, well, it would help if you lost weight. Oh, no, he also said they're also 50-year-old knees. Like I'm supposed to accept that. All right. So this is a silly thing that doctors do, but they are so focused on losing weight because losing weight has a lot of health benefits. But it's certainly, if I injured my knee, it's certainly not going to help my knee. Maybe it help it heal sooner, but how long does it take to lose weight? Anyway, so does obesity cause diabetes? No, they come from uh, the same root cause, and as do a lot of other conditions. The root cause is called hyperinsulinemia, and you will find some metabolic people who use that term to describe insulin resistance. Honestly, the one comes with the other. If you are hyperinsulinemic, meaning that you have elevated levels of insulin in your blood, it may not show in high blood glucose because that insulin is working. It's not you could go decades hyperinsulinemic, you could go decades before your pancreas can't keep up and you start showing signs of increasing blood sugar. But obesity is one of those things that a doctor will look at a patient and begin testing the blood glucose. Sometimes it's a 20-year lag, but they'll begin testing the blood glucose. High blood pressure, obesity, there are a couple of others that they would say, okay, let's start looking for these things. And if you have, 3 or 4 out of a list, you'll be diagnosed with metabolic syndrome. Whenever doctors use the word syndrome, by the way, pay attention to this. Whenever doctors use the word syndrome, what they are indicating is we don't know why the hell this shows up here. We don't know why you have this. But we do know why. And anytime there's a syndrome, irritable bowel syndrome, we don't know why. Really? Okay. We do know why metabolic syndrome is actually metabolic disease. In the Onesta process, we use the phrase metabolic disease. It's a condition that the body knows how to heal if you give it the opportunity to do so. Now, what is it? All it is hyperinsulinemia. That is, we eat so many carbohydrates, we eat so many things so often that we keep spiking our blood sugar so that our pancreas has to create more and more insulin to deal with it. At a certain point, the more insulin we need, the more insulin our pancreas creates. So the more hyperinsulinemic we become, the more insulin that's traveling around in our bloodstream all the time. Now, that creates insulin resistance, and up comes, you need more insulin to get it out. This is why we give type 2 diabetics insulin. When Hyperinsulinemia is the original problem. Think about that and swallow hard. So does obesity cause diabetes? No. Is it pretty common? Yes, but not everybody who is obese is diabetic. Not everybody who is diabetic is obese. You will find fairly fit looking clients coming in saying, I'm type 2 diabetic, can you help me? There's a famous comedian in England called Johnny Vegas, fat guy. And he was invited by some diabetes association to give a keynote address because they assumed he was diabetic. He's on television and he's saying, it's so funny. They asked me to speak, but I'm not diabetic. And so, when you assume, you make an ass out of you and me. Don't assume that because a person is fat that they're diabetic. When someone comes in my office to lose weight, I always ask them, are you diabetic? Are you pre-diabetic? Because I know the doctor may well have tested their blood because they're fat. That's one of the signs doctors use. So the next time a doctor tells somebody they'll just lose weight, that'll fix it. If we do it right, it just might.